There is a whole lot to unpack here. Our sports director, Jim Donovan, is going to join us shortly with our team coverage. He's going to have more on what this means for the two teams who are both embroiled in playoff races with the big implications. And Monica Robbins also joins us. She spoke with local medical professionals about what might have led to this bizarre and really unprecedented injuries. We've seen a lot of things on the NFL field. We've seen players hit and not move, and the fear that goes along with that. But this was a terrifying moment in which you knew in real time you were watching a player lie lifeless on the field in a fight for his life. We know he had cardiac arrest. We don't know exactly what caused it. We've heard a whole lot of speculation that it might have just been from the hit to the chest. Wrong exact time, wrong exact spot. What are you hearing about that?
You know, you're referring to commotio cordis. So it is a very rare lethal disruption of heart rhythm caused by a severe blow to the chest. Now, it occurs mostly in boys and young men up to 18, usually in sports. Hamlin took a hit to the chest, but we see that hundreds of times each season. We've seen cases of this in baseball and hockey, and while it is definitely possible, despite pads and chest muscles, I think they're going to have to rule out a lot of other heart issues first.
Right. All right. Well, why didn't they get him to the hospital sooner? And then once they did, now we've heard that he is sedated.
Yeah, there's really good reasons for that. And I know a lot of people were wondering that because it took about 20 minutes. So the medics on the field did nearly 10 minutes of CPR. They also used an AED to shock his heart before Hamlin came around. Now, it was very important to stabilize him before moving him, which is not unusual. The hospital was also likely well aware of what was happening, and they were well prepared when he arrived. Sedation after cardiac arrest is also not unusual. He likely underwent therapeutic hypothermia, which can help prevent additional brain damage. He's likely on a ventilator to help prevent further lung injury. And he's undergoing a battery of tests trying to determine what exactly caused his cardiac arrest. These are the critical hours. Most deaths occur within 24 hours of cardiac arrest.
Yeah, so it's important that he is breathing on his, well, he has a pulse now. And from some reports, we're hearing that his vitals have become normal. That certainly is a great sign. You mentioned something that many medical experts are hypothesizing is likely what we saw. Explain what that is.
You know, we have seen several athletes collapse from undetected heart conditions, and it is possible, even with those NFL physicals, that if he had one, it may have never been discovered.
Most of the athletic sudden cardiac arrests and death occur because of an undiagnosed underlying structural heart disease, whether that's hypertrophic cardiomyopathy, abnormal coronary arteries, inherited cardiomyopathies or inherited channelopathies, or some structural or electrical problem that actually comes out with sports.
So the doctors are looking at all of this. I mean, now really the detective work begins, and kudos to the medics on the field for getting CPR started as quickly as they did. If we can learn anything from this tragedy, it is that we all need to know how to do CPR. Because think about this, and AEDs at every public venue, obviously, because the people who mostly collapse don't have an NFL medic ready to run out on the field to help them. And this is something that typically would happen to a fan in the stadium.
The rare between heartbeats and the blow, you mentioned the name of it. I won't begin to try to say it because
commotio cordis.
So
or
we talked with,
we've heard it both ways.
We talked with Dr. Richard Figler. He is the former Browns team physician, currently has the same role with the Cavaliers. He was on the Ultimate Cleveland Sports Show this morning, and he said because of the trauma event directly to the sternum, that's most likely what this is. But as you said, 1 million tests need to be done to rule out everything else first.
I think exactly. I think if everything else is ruled out, that is the diagnosis that they're going to have to go with at this point. But keep in mind, there's about 30 cases of this reported in the U.S. each year. That's it.
Yeah, well, he said it's a millisecond that hit has to take place.
Timing and vulnerability.
Yeah.
Absolutely.
Wrong exact spot, wrong exact time. Monica, thank you. Great information there.